Many thanks for staying with us. Now, since the country identified its first AIDS case in 1984, HIV has remained a serious public health concern. And despite recent progress in the response to the epidemic in Kenya, pervasive stigma, discrimination, and human rights violations associated with HIV remain serious challenges. Tonight, we take this conversation further with Doreen Moraa Moracha. She is the founder of I Am a Beautiful Story Foundation. And also with us is Hellen Namisi, who is the chair of the HIV and AIDS Tribunal. Ladies, thank you very much for being with us on the show tonight. I'll start with you, Doreen. In terms of I Am a Beautiful Story Foundation, obviously this foundation is behind a beautiful story, and I would imagine that is your story. So tell us a little bit about yourself, why I Am a Beautiful Story, and in the context of HIV and AIDS, how did you come up with I Am a Beautiful Story?
Thank you so much, Lillian. So I Am a Beautiful Story was founded from my own lived experience as a person living with HIV. And I started this because I realized we are shying away from the HIV and AIDS conversation, and that has actually promoted stigma along the years. And the HIV is, I think, 37 or 38 years since the first case, and we keep fearing it, fearing going to test, fearing starting medication, and it's a normal health condition. I've lived with HIV since I was born to a HIV discordant couple, so my mom is positive, my dad is negative, and along the way, I suffered self-stigma, and I even stopped taking my medication because of that. And then I realized that I was giving so much power to a very tiny virus. So that is how I came up with I Am a Beautiful Story, to show that there is a beautiful life beyond my diagnosis. There is a life, a normal life beyond my HIV diagnosis, beyond the ARVs and all that. Is still a beautiful person who can do everything they want. So HIV is not a limitation despite that. So the stigma that I suffered through family and also from myself made me realize that we were just going round and round around the same fears and the same myths and misconceptions, while there are people, because out of, when we say 1.5 million Kenyans are living with HIV, and then you ask someone, how many of them do you know? They tell you, I don't really know anyone, but I know that there are 1.5 million people. So I wanted not to be a statistic, but to be a person, to give a face to the virus that a lot of people fear.
And you've zeroed in on stigma, Doreen. Yeah. Let's talk about, you talk about self-stigma. Mm-hmm. You yourself went through that. Yeah. However, from close family, from perhaps anybody else, what stigma did you experience? And you can give us particular examples that took you aback in terms of you living with HIV and AIDS positively, mm-hmm. And then having an element of stigma directed towards you.
So you see, my parents found out about my status when I was 8 years old. So what they did is they told the rest of the family. So you see, the disclosure was done without me even knowing that I have the condition myself. So they started, some of the relatives started treating me in a different way, like I am a different person. So I will go to their house and get my own utensils that were disinfected and sometimes even sun-dried so that they can kill the virus or something. And there's a brother of mine who was also born with HIV, but he died. So when he died, I went to live with one of the relatives. And so that was the treatment. My clothes were disinfected. I slept in the sitting room, not with the other kids. So at some point, you know, I never knew why I was being treated like that, because I have a condition, I don't know what the condition is, but now they are treating me like I am different, like it's contagious. So to a point where we will go to the shop, and because I was a little bit older, I will be told, you just go and say, I want bread. Then the little ones will be given the bread, they exchange the money, and then, so my work was just to be a mouthpiece. So all this came together when I now knew I have HIV. And I'm like, that is why they treat me differently. That is why they think I need a special diet. They think that I cannot associate with them and share things with them freely. And we are way beyond that kind of stigma. And it kind of created some sort of rift because I didn't feel like they looked at me beyond my status.
Thanks for sharing that, Doreen. I'll come back to you.
Okay.
Let me now cross over to the chair of the HIV and AIDS Tribunal, that is Hellen Namisi. Hellen, listening to Doreen's story there, let's zero in on the extent of discrimination and stories similar to Doreen's that perhaps have come your way, that you have heard about, that you have had to deal with. What is the extent of the discrimination years after the country has put in efforts to fight stigma around this pandemic?
Okay, good evening. Thank you, Lillian, for having us. It's actually a very sad story to hear what Doreen went through, and to be very honest, this is something that is rampant. Discrimination is everywhere, especially for persons living with HIV. And unfortunately, some of them might not even know that they're actually facing it. So we have a lot of stigma and discrimination in the workplace. In schools, you may have a case where some student is not allowed into a school because they are HIV positive. And it may be, as is Doreen's case, that they were actually born with it. You have situations where, for instance, you're required to take a test, an HIV test, before you can receive some service, be it a job, for example, to get employment, be it getting into a school. And the Act actually says we have the HIV and AIDS Prevention and Control Act, which talks about something as simple as getting married. So I know it is very common and it is quite against the law for the churches to insist that you must go for an HIV test before you get married, because they are compelling you to do it. And as we have seen, unfortunately, years down the line, we still have discrimination, stigma. It's the way we treat each other. We treat these people as though they're not humans anymore. And it's quite distressing that even with the gains we have made in science and in treatment, that we are still treating our counterparts this way. Yes.
And you pointed out that some people may not even be aware that this is discrimination, that it is a human rights violation. So in terms of the HIV related legal issues of concern, things that might be done to people who are living with HIV AIDS that are actually legal issues of concern for you as a tribunal and for that individual who is actually facing a gross human rights violation?
Let me give you a couple of examples, Lillian, and these may not necessarily affect just the persons living with HIV, but all of us. So, for instance, you have, say it is myself, I walk into a facility, a medical facility, because I am feeling ill, maybe I'm feverish, I have joint aches, and the usual thing is I think I have malaria. So I walk into a medical facility, I will go through the nurse's station, I will go to the doctor, and he tells me, okay, I think we need to run some tests. That I go to the lab, my blood is drawn, tests are run, and when I walk in for the results, he then tells me I'm HIV positive. He did not consult me before conducting that test, so he tested me without my consent. Secondly, he did not even offer me any pre-test counseling, which is a mandatory requirement that he must. And going back to the consent issue, Lillian, he must have enabled me to give informed consent. So it's not just an issue of we are going to carry out tests. Do you agree? Yes. No. I must be aware of what tests are being carried out. I must know the repercussions. What are the risks? What happens if I turn positive? You know, how do I live? There must be post-test counseling. Now, assume that when I went into that institution, I was employed, and my employer provides a cover. So obviously, the results are then going to be written out on some sheet of paper, and then, you know, they're going to be forwarded to the insurance company because the insurance has to pay. And then the insurance says, I'm sorry, but we have noted that there was HIV and you're positive, so we are not covering you anymore. That was disclosure. They disclosed to a third party without my consent, and then send it over. The insurance most likely is going to send it over to the employer and say, there's one of your staff members we are not going to cover because of this reason. Again, disclosure. So as I said, it is quite often we find that there are very many people out here who have no idea of the violations that are happening to them. And it's not necessarily just the persons living with HIV.
Right.
It's all of us.
Right, it's all of us. And in terms of the tribunal and in terms of awareness, I think very important to ask whether the tribunal has made the populace and the different constituents of different areas in this country aware of your existence, first of all, and secondly, whether you have advanced the human rights of people living with HIV AIDS. As we speak, I think you're about 4 years or so into existence. I might be wrong, but the strides that you as a tribunal has made in the fight against discrimination and stigma against HIV and AIDS.
Okay, just to show you how little people know about the tribunal, we've been in existence since 2012. So it's more than 4 years. And yes, you do make a good point that very few people actually know about the existence of the tribunal, which is something that we are working on actively to ensure that we actually get down to as basic as the grassroots, because that's a lot of where the violations happen. You'll find that the more educated people might have some knowledge or at least know where to get the information. But the indigent people do not know and do not know that we exist, do not even know that their rights are being violated. So creating awareness is something that we are actually actively pursuing in the next 5 years to ensure that by the time we hit 2025, the HIV and AIDS Tribunal will be a household name. And that's why we thank you very much for this opportunity, because at least we are able to spread the word to more than just Nairobians.
And perhaps of concern to some people would be the legal fees. The fact that for a lot of people, they might find that this tribunal, and it might be, of course, a misinterpretation on their part, that the affordability of the legal fees may be way beyond anything that they could afford. Is that a fact? Is it an affordable service for people out there who might actually find themselves in the way of needing legal intervention?
One thing we pride ourselves about is that we are one of the least expensive tribunals, in the sense that we do not charge filing fees at all. So you at the moment we do not charge. So you can walk in, file your complaint, file your case, all the way to the end. We will not charge you a single shilling. So that we are dealing with the masses that definitely are the ones that are being violated, and they're the ones that need our services most. Yes.
Okay, and back to you, Doreen, as we begin to close. You are very vocal with your I Am a Beautiful Story Foundation on social media, and you're a fairly young lady. Your acceptance of HIV and AIDS as being your reality, how has that translated in terms of forming and shaping opinions against stigma? You, of course, have a massive following as a young lady who has openly spoken about her status publicly, and therefore, how has this shaped and changed opinions around HIV?
By sharing my story, I get to meet other people who have actually, some of them have come out publicly, some of them have accepted and they've said, if you've done this your whole life, then definitely it's not something that is going to be difficult for me to take. Some of them just take me as their learning point or the learning tool to see how do I go through life like on a day-to-day as a normal person without making HIV a barrier to me. And I think with time I have managed to actually get people to understand that living with HIV is not what it used to be when HIV first came to the country. So it's time we really normalize the HIV conversation.
And talking about normalization, you have been living for the last 28 years or so, and you are thriving and you are living positively. So share some of your wins, even as, of course, you communicate to our viewers about stigma and eradicating it altogether as a young lady. What have been your wins?
So far, I have really won, I can say that. And first of all, I am part of the International AIDS Society Young Leaders, who we are creating a digital hub that is going to shape the HIV response among young people, both affected and infected with HIV. And I am also part of the Generation Equality Forum that is shaping the issues of gender equality. But now I represent the HIV constituency, where we're trying, because Sub-Saharan Africa has the highest number of women living with HIV. So we're trying to shape the conversation that how do we reduce these these numbers, and how do we move forward and this for these women to just cut down the new infections, and also how does gender come into the whole new infections when it comes to women living with HIV. This week on Wednesday, the National AIDS Control Council awarded me the Advocacy Award in communities of adolescents and young people living with HIV in basically advocacy. And last year, November, I was awarded the International Stigma Warrior Award by the International Stigma Conference, because of how vocal I am and how outspoken I have become by just basically shaping the HIV conversation and showing people that you can live beyond those two lines that diagnose you.
And that is a very positive note to end on, and we celebrate you. Please continue being a voice for the voiceless. We thank you so much for your time tonight. As we close, very quickly, from the tribunal, your parting words as we close.
We need to get rid of stigma in this country. If we are to address HIV, we need to get rid of stigma. We need to be more open as a society and embrace persons living with HIV.
Yes. Many thanks for that. Hellen Namisi, chair of the HIV and AIDS Tribunal, and Doreen Moraa Moracha. She is the founder of I Am a Beautiful Story Foundation. You can look her up on social media. She is very active there as well, and continue following her story there. Many thanks for joining us tonight. My name is Lillian Muli. I've been with Yula Nzale-Ann on behalf of the team. Thanks for watching. Enjoy the rest of your viewing. Up next is Willis Raburu with 10 over 10. Good night.